Hi, and welcome to I Have a Client Who, Pathology Conversations with Ruth Werner, the podcast where I will discuss your real-life stories about clients with conditions that are perplexing or confusing. I'm Ruth Werner, author of A Massage Therapist's Guide to Pathology, and I have spent decades studying, writing about, and teaching about where massage therapy intersects with diseases and conditions that might limit our clients' health. We almost always have something good to offer, even with our most challenged clients, but we need to figure out a way to do that safely, effectively, and within our scope of practice. And sometimes, as we have all learned, that is harder than it looks. I often like to do episodes about stories where the contributor gives me lots and lots of detail, mostly because they've done most of the work for me. But today I am going in the opposite direction. Our letter today is short and sweet. Dear Ruth, I hope you are well. Quick question. Have you come across any precautions or contraindications of offering massage therapy with an individual who has had an implanted vagus nerve stimulator? Many thanks. Well, thank you, contributor. I am well. I hope you are the same. And no, I don't know anything about massage in the context of an implanted vagus nerve stimulator. So let's see what I can find out. And for the purposes of our podcast, we will now skip the several hours that I spent looking into this. Okay. Well, the first thing I found out is that vagus nerve stimulation, or VNS, can be used for a variety of things. The main one appears to be for seizure disorders, especially epilepsy, but this is also used for hard-to-treat severe depression, stroke rehabilitation, and headaches. Many, many more uses are on the close horizon. Obviously, each of these carries different implications for massage therapy, so the very first follow-up question must be why? Why do you have a VNS device? But we will come back to that later. I can also tell you that this is not a first-line therapy. Vagus nerve stimulation is reserved for when other, less invasive options have not been sufficient. But because it does not involve hardcore anti-seizure drugs and its side effects are surprisingly benign, it has a lot of advantages over traditional pharmacologic approaches to some disorders. So what is this all about? How does it work? What's involved with getting the implant? What kinds of side effects does this create? And most of all, what are the implications for massage therapy? Let's start here. What are vagus nerve stimulation devices all about? I hope that you remember that your vagus nerve is the longest and most wide-reaching of all the cranial nerves, and its name comes from the same word root as vagrant, vagabond, and vague, all suggesting wandering or being a wanderer. It emerges from several locations in the brain, and it travels to organs of the thorax and the abdomen. So along the way, it touches the heart and the lungs and the intestines and the pancreas and the liver and the blood vessels that keep us going. The vagus nerve has both sensory and motor fibers whose job is to convey instructions about parasympathetic responses to and from the brain. And those parasympathetic responses encompass a lot of our goals with massage, right? To slow the heart rate and drop blood pressure and boost digestion and slow respiration, and lots more. In addition, the vagus nerve is key to the brain-gut axis, which allows us to regulate peristalsis and gastric motility and may have an impact on our gut microbiome. It even influences our immune system function and the inflammatory process. If the vagus nerve does all that, and if some of these processes aren't working well, what would happen then if we gave the vagus nerve an extra little jolt of activity? That is the thinking behind vagus nerve stimulation. So how does a VNS device work? What is it good for? The first widespread use of VNS was for drug-resistant epilepsy, a type of seizure disorder, and that started in 1997, which, in terms of medical devices, is pretty recent. This is still a newish kind of technology. At first, it was only used for adults, but in 2017, it was approved for use in anyone over 4 years old whose epilepsy could not be controlled with medication. And the results have been remarkably positive. It has a great safety record, and it does not carry all the side effects of anti-seizure drugs, which can be extreme. How does it actually work to control epilepsy? That's not clear. But animal models give us some clues. And just to let you know, it is really, really complicated. Just in case this is your jam, here's a quote from a 2023 Physicians Continuing Education document that is listed in our bibliography. This is the quote. A precise mechanism of action is still inconclusive, but the following are generally agreed upon based on human and animal studies. In animal epilepsy models, VNS has caused abruption of an ongoing seizure and a decrease in the frequency of chronic seizures. Zabara postulated that high synchronization of the cortical and thalamocortical loops are the basis of the complex partial seizures in animal models. VNS intervention breaks these synchronized networks and thus mitigates seizure activity. NTS projections into the raphe nuclei and the locus ceruleus play an important role in the VNS neuromodulation therapy, purportedly by increasing the serotogenic and noradrenergic transmission, evidenced by the increased levels of serotonin, noradrenaline, and its metabolites in the cerebrospinal fluid of the patients undergoing VNS stimulation. Serotonin and noradrenaline have been known anti-seizure effects. Okay, did that help? Because I will admit it didn't help me much. It does, however, remind me of how little I know about the inner workings of the brain. Vagus nerve stimulation was approved to help with severe depression in 2005. Again, the mechanisms aren't entirely clear, but when people had a positive response and then the VNS device was removed, they relapsed into depression again. And that seems like a good indicator of efficacy. And it has been approved for people in rehabilitation to improve hand and arm function after an ischemic stroke. The theory here is that it stimulates the motor cortex that controls movement. What is involved then with getting a vagus nerve stimulator implant? Well, it turns out that there are varieties of types and brands of VNS devices. Some of them are surgically implanted. Others can be used as externally attached equipment that work through the skin, and those are called the non-invasive VNS devices, or NVNS. The implanted devices involve a pulse generator that is placed under the skin of the chest and a lead wire that connects it to the vagus nerve in the neck. And this is the type that is most often recommended for both epilepsy and severe depression. The implantation process involves local or general anesthesia and 2 incisions, one at the neck and one at the chest, where the pulse generator and the battery are located. The batteries last about 6 years, and they are replaced with a simple inpatient procedure. After all of those incisions have healed, then the healthcare provider works with the patient to set appropriate levels of stimulation and the right on-off cycle for the device. The person can also use a handheld magnet for extra stimulation if they feel a seizure is coming on. Non-invasive VNS devices may also be used for depression, and people are now using them for migraines and cluster headaches and anxiety and lots more. They may even turn out to be helpful for long COVID and postural orthostatic tachycardia syndrome, or POTS. Both of these have to do with autonomic dysfunction. They're also looking at NVNS devices for autoimmune disorders, and that ties into how the vagus nerve affects inflammation and immune system activity. Probably most of that happens by way of the liver. The NVNS devices work by activating a branch of the vagus nerve that is accessible near the ear or near the carotid artery. These are not as precisely calibrated as the implanted devices, but they can be applied and removed as needed. What kinds of side effects do these things create? VNS, as we've said, is a relatively new intervention. Not surprisingly, in the early years, there were some side effects related to the process of implanting the device. like facial weakness or broken electroleads. But with experience and improved expertise, these side effects are now pretty rare. The main negative consequences of VNS include infection risk during the insertion and coughing, hoarseness, voice alteration, trouble swallowing when the device is on. And those side effects often resolve with time. What I'm really interested in is if someone with a vagus nerve stimulation device has any limitations on physical activities, because that could also tell us about the safety of massage therapy. And here's what I found: almost nothing. In fact, one small study from England found that people who use a non-invasive VNS device for 30 minutes every day seemed to have improved oxygen uptake during exercise. And they tested this with a control group who had fake devices, and then they switched the groups to make sure that that effect was the same. And follow-up blood tests also showed lower levels of inflammatory chemicals among the vagus nerve stimulation users. The only caveat is that some devices should not be used during swimming, and that is something that needs to be worked out with the physician. All right, we've gathered a bunch of information. Do we have enough to figure out the implications for massage for today's contributor? Well, yes and no. Because as you heard at the beginning of this episode, we have no information about this client, which is hard because now I'm sort of making assumptions in the dark. And please don't do this with your real clients. We also learned that having or using a VNS does not involve any major limitations in physical activity. People with these devices can exercise, they can do sports, they can live normal, healthy lives, which means they can probably also receive massage as long as whatever their VNS is treating doesn't contraindicate bodywork. Well, depression doesn't contraindicate massage. Headaches don't. People who are recovering from stroke might have some different kinds of guidelines. And that, of course, is a good time to consult with the healthcare team about the best ways to integrate your work with theirs for the best outcomes. I will add that for people with an implanted device, it seems sensible to avoid deep work in the anterior neck, which we usually do anyway, just in case we encounter the lead wire. And for clients who use an external device, I would recommend removing it during their massage therapy session. But let's assume that this client for today is using VNS for the most common reason, which is epilepsy. Having a VNS device doesn't cure or fix epilepsy, and it doesn't mean the person can stop using anti-epileptic medications, but it does mean that the amount of medication and the frequency and severity of the seizures should be reduced. So this then takes us back to basic guidelines about massage therapy and epilepsy, which is that we need to know what kinds of stimuli are most likely to trigger an episode. Because for some people, they are sensitive to things like flickering lights, which might be made worse by overhead fans, or certain odors or certain sounds, so we can control our environment for them to be as comfortable as possible. Anti-seizure medications can make people feel really tired and logy, so we may need to accommodate for that with shorter sessions or more energetic kinds of strokes to finish the session and plenty of time to transition afterwards. But otherwise, we often see some really nice results for massage therapy and people who live with seizure disorders. So by all means, go forward with caution and confidence and curiosity. I have to tell you, my friends, I took on this topic with some reluctance. Frankly, it was a lot of work to put all this together, but I learned a ton in the process, and some of it was really exciting for me, and that makes me wonder if I will be writing about VNS in more contexts in the near future. In that vein, I'd like to conclude this episode with a list of off-label or experimental uses for vagus nerve stimulation that might capture your attention. I have found case reports and suggestions for experimental studies and early concept studies for all of these using vagus nerve stimulation for tinnitus, for intractable hiccups, improved memory, chronic pain like we see with fibromyalgia, bipolar disorder, rheumatoid arthritis, diabetes, sepsis, irritable bowel syndrome. And some researchers are looking at vagus nerve stimulation to influence cardiovascular and inflammatory function to alter the course of heart attack and atrial fibrillation and coagulopathy and hypertension. The possibilities are far-reaching, and the chances that you might someday soon have clients with a vagus nerve stimulator are high.